So this video I'm filming in hopes that if someone has a post-traumatic stress disorder and is looking for ways to help and improve and go to therapy, I want to kind of inform and spread, I want to inform that one type of therapy called cognitive processing therapy helped me out, and this is the type of therapy that my psychologist sort of used on me to treat and to process the trauma. This therapy took me about 6 months to complete. It was done like once a week for 1 hour for like 6 months. And so the first thing that they want you to do is to write an impact statement. So the impact statement is sort of an essay prompt. They give you, the prompt says, stay there, won't stay. The essay prompt says, write about why you think the trauma happened to you, how you explain the trauma to yourself and the traumatic events, and how they impacted you and your views of yourself, the other people, and the world in general. So they kind of want to know how those traumatic events impacted you. So my first impact statement was like all over the place. Like I couldn't really explain why. I would explain why, but I felt like I focused. There's no right or wrong, obviously, to write this impact statement, because it's just, it's just like what you think. Like it's your personal account, and so then you write this impact statement. You come to the psychologist. You go over that, and the psychologist may ask you a few questions, whatever, and then there's 4 chapters that you're supposed to go through. And the first chapter is called, there's 4 of them. So trust, control, and power. Trust, power, control, self-esteem, and esteem. And the fourth one is safety. It's so the way that it was structured, that my psychologist was saying, okay, so today we're going to talk about safety. And so what is like safety to you? Like what is something that, about safety that you struggle with, and I would share. And then we would come up with a strategy or like an antidote to kind of help me out with this chapter, with this issue, according to cognitive processing therapy. And so for safety, it was basically like kind of saying to yourself that you can protect yourself from harm. And for trust, I've learned that trust is not like all or nothing. Trust is like a percentage wise. It is flexible, and every person, it's not like you trust this person or you don't trust the other person, because you can trust this person to do like the most basic things. Let's say you trust this person like 20%, and the other person you trust like 80%. So it's like the trust is not like all or nothing thing. It's very like, I don't have to grade that. Then there's the third thing, power and control. So the same thing psychologist says, okay, so today we're gonna talk about power and control. And so for power control, I want you to, and every time we talk about this chapter, she says, okay, go back to your impact statement and revise it according to what you learned in this chapter. So about safety, about trust, like look for specific phrases, look for specific things in your impact statement that tells you about what do you think about safety, trust, power, and control. And so I would have to during the 6 months or whatever I've done, and that includes breaks, that includes like holidays. So I'm sure this therapy with cognitive processing therapy could be done in much shorter periods of time. So, and she says, okay, so go back to the impact statement, and I would revise that impact statement for about like 5 to 6 times, like different versions of that impact statement. And So for example, for power and control, like, you know, you feel very like a little power, you feel like that you don't really have control much of what happened to you, like over your life in general, and you feel powerless. So she told me like, okay, look for ways, like what is, like, when do you feel powerful, when do you feel like you're in control, what does it mean to you, like power and control. And then she says, like, look for ways, like practice it and revise your impact statement, kind of incorporate the new statements, incorporate the new, like, healthy and rational and optimistic, not optimistic, but like healthy statements about those issues. So then talked about self-esteem and esteem. So self-esteem is about you, and esteem is how you perceive and how you think of other people. So, and she said that self-esteem should be realistic, optimistic, flexible, positive, and changeable. So, you know, like, it should, like, it's okay for the self-esteem to change a little bit and to kind of be appropriate and realistic in terms of situation you have, but overall the tone of your self-esteem should be optimistic and positive. Like, should be, you know, you think of yourself in a positive, in a, like, yeah, I can do that, yeah, I'm good enough, you know, and that's fine. Like, that's like the base no matter what. So yeah. And then we also talked about, like, changing your thoughts. I mean, this is like processing. I feel like it's, well, I mean, obviously I'm not a psychologist, I'm not a mental health professional, but I'm you know, someone who's done this therapy on myself. I mean, someone who went through this therapy, tried this type of therapy modality. I can see that the processing part is like you kind of talking to a psychologist, and you literally like work on the story, look on the narrative, and look at the impact statement by revising it, by going back to it, and sort of like processing. And the cognitive part is really for me was to work on my own thoughts and how I think. So, for example, identifying the anxiety-inducing thoughts. You know, if there's an event, there's a thought, there is, you know, challenging and debating that thoughts. You know, you have to kind of debate the thoughts, whatever the anxiety-inducing thoughts you have, for, like, is it for, like, arguments for something and arguments against this something. So you can find a more rational thought process when you debate yourself, kind of like you hopefully come to a more realistic thought. So you also have to identify your stuck points. So stuck points is like the thoughts that like stuck in your head and you don't know, I guess, how to resolve this. I guess it's how I view them. So stuck points is like, you know, it's like a consistent thought. Let's say you want to start doing something new, and then you have this thought like, oh, I'm gonna fail, like I've done so many things wrong, probably shouldn't start it now, like I should have started earlier, like why did I have to, the past defines the future, like my past mistakes define what I see, what I do right now, like I'm a failure, I haven't done enough, I should have done it earlier, like what's the point of starting now? So all these points that, I mean, all these thoughts that kind of like keep you stuck. You have to identify them, you have to write them down. And so then what else I found, that to kind of resolve those anxiety-inducing thoughts, you have to think of it in terms of like a helicopter view. Let's say, like, you know, bird view. Like look at your life from a bird view point and see how this little or whatever anxiety-inducing thoughts or event comes into this big puzzle of your life, big picture. See the big picture, basically. You can also look at that event or look at that thoughts that induces anxiety in you from somebody else's perspective. Let's say that would be somebody else's life, and you will look at their life, and you will like basically what would you tell that person, and then look at your life from 10 years from now, like how would it look right now, in terms, like if you looking at this present day as if you were in the future, like your future self looking back to this present day. So that hopefully can help you out, like look at these things in a perspective versus feeling overwhelmed and feeling small and powerless. This is like the next day I'm filming this video, 2 days after, because I was interrupted. Basically, there was a change in my impact statement as a result of the therapy. First, like if I was only looking at the negative and how like the traumatic events impacted me in a negative way, and I felt very powerless. As a result of this therapy, as a result of kind of talking, so you don't feel as much shocked and overwhelmed. I still feel overwhelmed about a lot of issues, but certainly talking about those things, it kind of like got incorporated, compartmentalized in my brain of the whole like traumatic experiences. But I still feel overwhelmed. Like it's not like anxiety went away, whatever, but like it just got easier, a little bit easier. So it's definitely a plus. And so my impact statement changed from that to being more resilient, like seeing yourself as a survivor, not as a victim, seeing yourself as a powerful person who is in control of ultimately my destiny, my life, and like feeling that I'm not that powerless and didn't have some power in my life. So that was the end result of this therapy. Obviously, like I've asked my psychologist, like, how do I know if I don't have PTSD or whatever? And she's like, well, that's like very fluid because our like brain and just our mind is very like there's no yes or no answer. It's just like you have to track how you feel and do what is necessary to make you feel better in terms of therapy and self-help practices that I've kind of learned. So that's it. But I would recommend this therapy because I don't know why the psychologist chose to practice this therapy. It depends on what they trained in. But like I feel like if they see, like a psychologist I guess saw that, oh, you have PTSD, okay, let me treat you with this PTSD like effective or like a standard or prescribed modality that they use for PTSD patients. So and that's where they got me with cognitive processing therapy. And I kind of recommend it because it's not taking that long. It's not anything, doesn't really go out of the way of talk therapy like the normal sessions. It's effective, I think. Well, at least it helped me a little bit. So that's a plus. And I feel like the more you talk about your experiences, the more just it helps you process. Like that's what it means when they say, for me personally, that's what I think it means. Like when you process a traumatic experience is by talking about it, and it is by learning, like making it as a narrative and compartmentalizing in your brain. So it alleviates you from feeling trapped, feeling stuck in that. I'm not thinking about it.